what's going on today?
I have a chest pain.
How long's that been going on?
About 20 minutes or so.
What's his respiratory rate?
42.
Oh, what's his pulse oximeter? Let's get a pulse oximeter on.
88%.
And what's his skin feel like?
Flipping diaphragmatic.
Okay, well let's get a non-rebreather on him, 15 liters per minute, and see if that helps you any at all. Do you take any medications?
I take a bunch.
What do you take?
Ventolin, Lisinopril, Plavix, Nitro, and Viagra.
Okay. What do I hear when I'm sitting here talking to him? He's breathing 42 times a minute.
Audible wheezes.
Oh, you're wheezing pretty bad, huh? Have you used your inhaler today?
I have 6 times. It didn't work.
Okay. Do you have it handy?
I don't know where it went. I've been having a hard time.
Okay. If I was able to find it, what's the first thing I need to look at with that?
Expiration date.
Expiration date. Is it good? Does it even have any medicine in it? Right? Did you shake it up? Have you used this before? Did I just get it? Is this new? So is that new? Is it something you've never had before?
No, I've had it for a while.
So what history do you have?
A COPD. I had an MI in the past, and I have high blood pressure.
What's his heart rate?
60.
60. And he's pale, cool, diaphoretic. You in non-rebreather mask? Is that helping you at all?
It's helping me, yeah.
Okay. Are you allergic to any medicines?
Aspirin.
What does that do to you?
It's super upset stomach, and I vomit.
Oh, well, that's not good. But did the doctor actually tell you you're allergic to it?
No.
No? Okay. Does that pain get any better since I give you the oxygen?
Just a little bit.
A little bit? Okay. So he says it helped a little bit. So guess what? It's probably what is the problem. Let's just start there. What's the problem?
Breathing.
It's a breathing problem, right? So we've helped that breathing problem right away. First thing, I walked in and I seen him breathing 42 times a minute, and I can hear him wheezing without even listening. I don't even have to listen. Listening's a secondary assessment, right? But initially, you saw me do this right off the get-go, right? What did I just do? What vital signs did I just
His
assess?
pulse, his
respiration.
skin
His
turgor.
pulse. What's his skin? Is it cold? Is he cool, pale, diaphoretic? He's all of the above. I can feel that, and I'm done. I've already got the heart rate. Am I worried about what the rate is? No. Is it fast? Is it slow? Is it normal? Well, it's 60. It's normal. But he's breathing 42 times a minute. Why is that? What's the problem with that? I don't know. But let's treat that breathing problem that we've got going on, which is through that normal breather on his face. So at this point, I'm going to call for additional backup because this is an ALS patient, right? What's his pulse oximeter? Was 88%, right?
Yep.
I gave him a non-rebreather. I'm going to repeat his vital signs. What's his blood pressure now?
104/72.
Oh, well, that's gotten better. How about your breathing?
About 12 times a minute.
Okay, well, let's load you up on the cot and get you going to the hospital, okay?
Okay.
And get him up on the cot, get him in the back of the truck. We've got additional resources coming, whether it's ALS or it's a fire engine, whatever it might be. We've got additional resources coming. We get him up on the cot, we get him to the back of the truck, which is what do we do in the back of the truck? Right. Remember I told you guys in the class the other day, I said, look, we'll do our primary assessment, we'll get him up on the cot, we'll get him in the back of the truck, out of the environment, and see where we're at, and now we'll do our secondary assessment. So now, I'm gonna take a listen to you. May listen in both places up back. His wheezes are still there. We'll listen in 4 places on his chest. Do you hurt anywhere else?
Nope. Just my chest.
No. Are you dizzy or anything like that?
No.
No? Okay. How about when I stand you up? How did that feel?
A little dizzy.
A little dizzy? How's your fingers? Are they numb or tingling or anything? Okay. So, but his respiratory rate's come down. Why do you think he's got numbness and tingling in his fingers?
Decreased oxygen.
Right?
Well, would it be hypocardia?
He's absolutely, right?
No.
Right? He's not blowing off that CO2. He's breathing too hard, and he's got respiratory depression and wheezes, right? So we get him here. He's got numbness and tingling in his fingertips. He was hyperventilating because he was having a hard time breathing, which is very common. But we got him out there to the truck, and we're moving him that way.